वेलकम टू दिस चैनल। myself डॉक्टर टी एन देवनाथ, डॉक्टर मॉडर्न मेडिकल साइंस, मोटिवेशनल स्पीकर एंड लाइफ कोच। आज इस वीडियो में हम बात करेंगे हाउ टू स्टार्ट ओरल हाइपोग्लाइसेमिक एजेंट अकॉर्डिंग टू HbA1c लेवल। ये ADA अमेरिकन डायबिटिक एसोसिएशन के थ्रू पब्लिश किया गया है। इसके बारे में इस वीडियो में हम बात करेंगे। अगर आप शुरू करना चाहते हैं ओरल हाइपोग्लाइसेमिक एजेंट तो कैसे शुरुआत करेंगे। देखिए, अगर HbA1c लेवल लेस देन 7 है, if your level is less than 7, remember no drugs is necessary. You need to change your lifestyle. And it will help you to have better control on your glycemic control. Okay, but if you have 7 to 8.5 the HbA1c level, then we can start with one medication, and preferably we start with metformin. We'll talk in details. If you have 8.5 to 10 HbA1c level, then you need to go to dual therapy, and definitely if you have more than 10, insulin is the drug of choice, and there should be added oral hypoglycemic agent. Now if you want to start monotherapy, remember the drug of choice as an oral anti-diabetic drug, that is metformin. That is, you can say that is the gold standard drug for diabetes. Metformin we always give ODPC. ODPC means खाने के बाद, one not ODPC means PC is the factor we always give after food. Okay, so it can be given once or twice daily, even thrice daily also if you are taking 3 times meal. Okay, usually these are given, that metformin are given usually after dinner. Why? Because it will take care of your this one fasting hyperglycemia also. Then you will call the patient for after around 1 month, and you will see whether it is improving or not. If the level is satisfied, that means your sugar level is well controlled, then continue it. But if there is no control, that means the sugar level you are not satisfied with, then you can do it BD, that means 500 milligram twice daily in the breakfast, and after breakfast and after dinner you can give. That is the important point. Okay, and again if you see that is also not working exactly, but it is not maintaining very well, then you can do 500 in the morning, 500 milligram in the before breakfast you can do, and 1 gram you can do at before after dinner or before dinner. It is just along with the food only. Okay, so we can give up to 2 gram. That is, if it is not controlled, then we can go 1 gram twice daily, 1 gram twice daily before breakfast and before dinner. Okay, we can go. That is the, if you want to get the monotherapy of the metformin. But usually if it is not controlled with this monotherapy of the metformin, we usually go for dual therapy, right? In dual therapy you can add metformin with DPP4 inhibitor, that is vildagliptin, sitagliptin or linagliptin. Okay, now in the metformin it will be almost same. 500 milligram we will start, that is the starting dose, and we can go maximum 2 gram. Okay, that is important. And we will start vildagliptin 50 milligram once daily, then we can go up to BD, matlab twice daily, and we have to continue increasing the dose of the metformin according to this proforma. Okay, metformin, the fundamental is almost same. 500 milligram at dinner. If it is not controlled, then 500 milligram twice daily after breakfast and after dinner. If it is not controlled, then morning 500 milligram, evening 1 gram, and if it is not controlled, then 1 gram breakfast, 1 gram in the dinner, then that is total 2 gram we can continue for metformin. That is the formula. But for DPP4 inhibitor vildagliptin, we can go for 50 milligram once daily, and then we can increased up to twice daily also. For sitagliptin 100 milligram once daily up to 500 milligram BD ऐसे करके we can continue. Now if you want to give metformin plus sulfonylurea, remember sulfonylurea most commonly used is the glimepiride. Here the is protocol is the same. Here we can go 0.5 to 1 gram OD once daily, and remember the sulfonylurea, it is the notorious drug for the hypoglycemia. So we need to treat the patient, we need to alert the patient about the hypoglycemic symptoms, so that he can understand, he can identify the hypoglycemia, because hypoglycemia is very dangerous. That's why we try to give it at the daytime before breakfast. Okay, before breakfast we can give, we can continue 0.5 to 2 milligram, 0.5 to 3 milligram, 0.5 to 4 milligram, up to 4 milligram we can continue. Okay, then if it is not controlled, we can add other, not add, we can also give gliclazide instead of glimepiride. Both are the sulfonylurea. Either we can use glimepiride or either we can use gliclazide. In gliclazide 30 milligram once daily, that is also given before breakfast, because same group of drugs, same side effects, and we can go up to 90 and up to 120 milligram once daily. We give that is once daily. Okay, we can change, not change, we can increase the dose of metformin as well as the gliclazide, but gliclazide dose will be once daily only. Now we can also give SGLT2 inhibitor, that is very important and upcoming drugs, very good drugs. Okay, but UTI is the side effect of these drugs. Dapagliflozin we can give up to 5 milligram and go up to 10 milligram. Okay, and same dose will increase in the metformin. And remember that SGLT2 inhibitor is cause weight loss, Now if patient is already lean and thin, we won't prefer this SGLT2, but if patient is obese, so that will be the added advantage for this obese patient having the weight loss with the SGLT2 inhibitor. And it is frequently asked in the exam, what is the drug cause weight loss as the anti-diabetic drug? That is the SGLT2 inhibitor. Giflazin और dapagliflozin कोई भी यूज कर सकते हैं. It can go up to 20 milligram. Remember, it start dapagliflozin start with 5 milligram. You can go up to 10. Here we can start with 10 and may go up to 25 milligram. Now triple therapy, that is now patient is come, no, so we may use the metformin along with the DPP4 at the first, then you may use metformin with sulfonylurea. Someone may start with metformin and SGLT2 inhibitor. So what are the other drugs we can add as a triple therapy? If it is DPP4 already used, so we have an option of sulfonylurea, we have an option of SGLT2 inhibitor, we have option of pioglitazone. Sulfonylurea, it causes hypoglycemia as well as it causes weight gain. So lean and thin patient we can use. In obese patient we can use SGLT2 inhibitor because it will cause weight loss. Pioglitazone we can use in non-alcoholic fatty liver diseases. Now if you already use sulfonylurea, either glimepiride or gliclazide, we have an option of DPP4. DPP4 does not has any role on the weight control. It is weight neutral, so it will neither cause weight gain, neither cause weight loss. Okay, and if you are already used SGLT2, then we have an option of sulfonylurea or pioglitazone. This is all about these anti-diabetic drugs. Now look, if there is any comorbidities like MI, heart attack, angina, stroke, then definitely SGLT2 inhibitor we can prefer. And heart failure is definitely SGLT2 inhibitor is preferred, and in CKD, in kidney disease, SGLT2 inhibitor is preferred. Okay, the SGLT2 inhibitor is preferred. So this is all about this oral anti diabetic drugs or oral hypoglycemic agents. Now if you have obesity, semaglutide, this is an oral drug and we can give up to 14 milligram, 3 milligram once daily for 1 month before breakfast. If weight loss is not desired, and then we can go up to 7, and again if it is not, and then we can go up to 14 milligram to have a better weight control. Okay, postprandial hyperglycemia, this is one of the most common scenario we can see in the diabetic treatment patient. There we can use acarbose and boglibose, according to the meal. Along with the meal, we can go 25 to 50 milligram 1 to 3 times daily. After it is taken along with the food, or if you use boglibose, 0.2 to 0.3 milligram 1 to 3 times daily. With this we can go for this oral hypoglycemic agent treatment. And remember, metformin is the one of the drug of choice, or we can say it is the first drug to start in the diabetes, or you can say gold standard drug also for as a oral hypoglycemic agent. Now sulfonylurea, glimepiride is very much used, glimepiride, and pioglitazone we can add. This is all about this oral hypoglycemic agent. And remember, it is not for any prescription, not for don't try at your own home, and don't try this as your medication prescription, and it is only for the information purpose. And definitely you need to go to your doctors to have a better your glycemic control. Thank you so much.